Pharmacy provides a whole lot of different services. We're currently in our inpatient pharmacy where we take care of patients that are in the hospital as well as our infusion clinic. We also have an outpatient pharmacy both here in Ann Arbor and Toledo where we provide outpatient medications, and sometimes through mail order we send medications to our patients. But one of the unique things is we actually have pharmacists that talk to the patient, to the veteran, prior to dispensing their medication, review their medication profiles, answer questions before they even get the medications. We also have pharmacists in our ambulatory care and other specialty areas that work closely with nurses and providers to make sure that our veterans get the best pharmaceutical care that they can get. On any given day, we are doing 500 to 700 prescriptions just through the outpatient pharmacy. The inpatient pharmacy, depending on how many patients we have in the hospital, range to 1,000 products going out of here in any given day.
As a clinical pharmacist, we make sure that we are dispensing medications to our veterans that are the right dose, they're being given in the right route, that they are being given for the correct indication. And so day in and day out, we're a 24-hour operation, so we're always here to consistently make sure we're delivering safe care. Pharmacy is a funny environment because in the outside world, it's hard to really quantify how valuable our service is because it often isn't linked to reimbursement. And so you can't really say, you know, I can justify another pharmacist or I can justify another technician because, you know, you can't really prove our value. But when you have events that occur, you understand how valuable it is, or events that don't occur, you know, you understand how valuable it is to have each team member on board and have us staffed at levels where we can take care of our patients. So the most important part of pharmacy that people may not know is that we all do have to come together as a team and try the best we can to work efficiently and work well and work detail-oriented at the same time in a very fast-paced environment because our nurses are waiting on the floors to give medications, patients are waiting on us to get the care they need in a timely manner. So even though it may not be obvious, there's a lot of moving components and every single team member has to be aware of all the components within their scope of what they do. So I would say we're not just a medicine that's being tubed up to a floor. You know, there's been probably 2 or 3 sets of eyes on a medication. There's been probably at least 2 pharmacists who've looked at the prescription itself to make sure it's appropriate for the patient. So it's a very engaged process.